So tennis elbow, also known as lateral epicondylitis, is a painful condition on the outside of the elbow, generally caused by overload of the muscles and tendons on the outside of the elbow. Most often it comes with repetitive use or overuse and builds up over time, but can also happen due to an acute injury. Your elbow joint consists of 3 bones: your upper arm bone, which is your humerus, and the 2 forearm bones consisting of the radius and ulna. Muscles, ligaments, and tendons help hold these bones together. It's when the tendons that join your forearm muscles to the bones become irritated that you begin to experience tennis elbow. As the muscles and tendons are overused from repeating the same motions over and over again, they start to become damaged, resulting in pain and tenderness on the outside of the elbow. Despite its name, athletes aren't the only people who develop tennis elbow, and tennis elbow can often occur without any specific inciting event. Tennis elbow is most common in adults aged 35 to 55, but can occur at any age. Symptoms of tennis elbow usually develop gradually. Pain will usually begin as mild and slowly get worse. The pain in tennis elbow will occur primarily around the bony bump on the outside of your elbow called the lateral epicondyle. With this condition, you may experience tenderness, burning, stiffness, weakness, and pain with simple activities such as lifting and gripping. If you begin to experience elbow pain and symptoms similar to tennis elbow, you should first start with at-home care such as resting, icing, stretching, as well as adding compression with a brace or bandage. Taking non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen may also help to reduce the pain. If your pain won't go away or gets worse, then it may be time to make an appointment with an orthopedic specialist to come get diagnosed and further evaluated. The majority of tennis elbow treatment is done without any need for surgery, and most patients have success with non-surgical treatment. We will generally put together a customized plan that uses a combination of the RICE treatment, which includes rest, ice, compression, and elevation, anti-inflammatory medications to reduce pain and swelling, bracing, and at times a formal therapy program. For the vast majority of patients, tennis elbow is self-limited and usually will resolve in about 12 to 18 months. On rare occasions, we'll attempt surgical treatment, but most of the time symptoms will resolve with non-surgical treatment in time.